Hi, it's Serene here, and I want to talk today about the difference between type 1 and type 2 diabetes. This is going to be a really brief explanation. I'm not going to go into a lot of detail. I will do that in some future videos where we just talk about one or the other specifically. But I do want you to have an understanding of the difference. It's confusing. They sound a lot alike. The names are similar, but they're very different from each other. So type 1 diabetes is an autoimmune disorder where insulin production has stopped. And this means that the person with type 1 diabetes does insulin therapy every day. It's what they need to survive. They have to have insulin. They use it before meals. They use it to adjust for high blood sugars. They depend on insulin, and they don't do anything to cause it to come upon themselves. And there's currently no cure for type 1 diabetes, but there are a lot of fabulous management tools, and we know a lot more about type 1 diabetes than ever before. So management is better, outcomes are better, and the person with diabetes can live a full, happy life. And so type 1 diabetes, a lot of management, but we also have a lot of resources. Type 2 diabetes is a little different in that the person is still producing some insulin. They have either become resistant to the insulin they're producing, they don't produce enough insulin for their needs, or often it's a little bit of both. Now, this is frequently brought on by just genetics or age. There's a lot of things that we can't control that create a person to have type 2 diabetes. There's also lifestyle management skills to help prevent it, such as staying active, maintaining a healthy weight, things like that. But it is a little different because the person is still producing some insulin. And we also know a lot about type 2 diabetes more than ever before. And we have many ways to manage it. And both type 1 and type 2 diabetes are very individualized depending upon the person. It's not the same for any one person. So if you know somebody who has diabetes, please ask them what kind of diabetes they have. That would be a really good first question. Just say, hey, I'm really interested to know more about your diabetes. Can you tell me about it? What kind of diabetes do you have? Ask them what they do to manage their diabetes. Ask them how you can help support what they're doing to manage their diabetes. Specifically ask them how you can help them if they have low blood sugars. That is something a friend can do to help. But it's really important to have that support. So you could be that support person for them if you just ask a few questions so that you understand it a little bit better. And it could make a world of difference for that person who has diabetes.